Well, I'm delighted to welcome Sarrah Peerbux. Sarrah is based at Imperial College London and is the trial manager for the NIHR HTA-funded PETS study. This is a multi-centre cluster random control trial examining the benefit of graduated compression stockings for the prevention of VTE in patients who undergo short-stay surgical procedures and who are assessed as low risk for developing a VTE. So this is really good coming on the back of the last talk, actually, where we were discussing prevention and management of patients at risk of VTE. Today, Sarrah is here to share an update and news of how you can become involved in this study. So I'll pass over to Sarrah. Thank you.
Thank you very much. And as Jo said, I'll be presenting on the PET study, which is an NIHR HTA-funded cluster randomised controlled trial evaluating the benefit of graduated compression stockings for the prevention of VTE in patients who are assessed as low risk of developing VTE and who undergo short-stay surgical procedures. And the study is led by Professor Davies at Imperial College London. So graduated compression stockings, or anti-embolic stockings, which is what we are evaluating as part of this study, apply a level of pressure or compression to the leg, as you know. But they can result in adverse side effects for the patient, and they are costly and time-consuming to apply. In terms of background as to why we're conducting the study, hospital-acquired thrombosis refers to any VTE-related event within 90 days of admission to hospital and encompass both DVTs and pulmonary embolisms. And it's associated with significant morbidity, mortality, and healthcare-associated costs, as displayed here. Although surgery is an established risk factor for VTE, operations or procedures with a short hospital stay, so typically less than 48 hours, and those which permit early ambulation are associated with a lower risk of VTE. And graduated compression stockings are designed for immobile patients at risk of VTE. However, the effectiveness or the benefit of these stockings have recently been called into question, as we'll see in a moment. So what do the NICE guidelines say? Well, the 2007 guidelines for the prevention of VTE stated that all surgical patients should receive stockings to reduce the risk of VTE. And these were then superseded by the updated 2018 guidelines, which stated that only certain patients undergoing certain procedures should receive graduated compression stockings, and to consider the use for those undergoing cardiac, vascular, and ENT related procedures. And so the interpretation of these guidelines has meant that many patients receiving a general anaesthetic for a day case or a short stay surgical procedure still receive stockings despite being ambulant and despite being discharged early or on the same day. So what do we know about the role of graduated compression stockings? Well, all the evidence is poor, and a recent systematic review led by Matt Machin and the team from Imperial failed to identify any relevant randomised controlled trial. And PETS is the natural follow-on from the GAPS trial, which was also led by Professor Davies and the team from Imperial College. And the GAPS study found that graduated compression stockings offered no additional benefit when combined with low molecular weight heparin compared to low molecular weight heparin alone in patients who underwent elective surgeries and who were assessed as moderate or high risk of VTE. And finally, a recent Cochrane systematic review again failed to identify any relevant randomized control trials of interest. So taken together, there is limited evidence on the use of graduated compression stockings in the cohort of interest here, so low risk short stay surgical patients. And this is despite the widespread use of graduated compression stockings. And of particular note is the fact that the predicted cost of using stockings in day case surgical procedures is estimated to be as high as 23 million. So all the evidence points to the need for this PETS trial, where the main aim is to evaluate the role of graduated compression stockings for the prevention of VTE in patients who undergo short-stay surgical procedures and who are assessed as low risk for developing VTE. So the primary objective is to evaluate the benefit of stockings, as already stated, and the secondary objectives include looking at mortality rates, quality of life, to assess the adverse events associated with wearing the stockings, and will also be performing a cost effectiveness analysis. So this is a cluster randomised controlled trial, and we'll be recruiting from at least 50 NHS trusts or health boards across the UK. And because this is a cluster randomised controlled trial, randomisation will be conducted at the site level rather than at the individual participant level. So what this means is that sites will either be randomised to the intervention arm, where patients will receive stockings, or the control arm, where stockings will not be provided. And of particular interest is the fact that trusts can choose which individual surgical specialties they'd like to involve. So if you would like to involve urology and orthopedics only, rather than a blanket change of policy, that's absolutely fine. So we are aiming to recruit 21,472 participants. So this is a large trial, and patients are eligible if they are between the ages of 18 and 59 years of age, and if they're scheduled to undergo a surgical procedure with a hospital stay of less than 48 hours. And if they're assessed as being low risk of developing VTE using the Department of Health's risk assessment tool. So if they score 0 on that tool. And participants are excluded for a number of reasons, including if they have a contraindication to wearing stockings, if they are assessed as being at moderate or high risk of VTE, if they require therapeutic anticoagulation, if they require intermittent pneumatic compression therapy, and if they are female patients of childbearing potential who have a positive pregnancy test. So essentially, if an individual scores a tick in the thrombosis risk section of the Department of Health risk assessment tool as displayed here, then they are excluded. And because this is a cluster randomised control trial, patients only need to provide consent to be contacted for follow-up. And consent can be obtained at any point on or before the initial 7-day follow-up, and it can be obtained verbally, in person, so in written format, or electronically. And the follow-up is conducted centrally by the team at Imperial College London, and what that means is that local site staff are only responsible for the screening and consenting of eligible participants. So participants are contacted at 7 and 90 days post-procedure. These follow-ups are performed remotely, so via telephone or online survey, and the follow-ups comprise of a few short questions on self-reported VTE outcome, the EQ5D, so assessing quality of life. We'll also be assessing adverse events associated with the stockings in the stockings cluster, and we'll also be collecting information on healthcare resource use at 90 days. The primary outcome here is the rate of symptomatic VTE within 90 days. And here we can see a flow diagram displaying participant flow throughout the study. So in terms of timelines, the grant was activated last April, and we commenced recruitment in September last year. Recruitment is due to end in March 2025, so we have another 18 months to go. We have an official end date of December 2025. So we have recruited just over 3,300 to date, and we currently have 42 sites set up, and we are looking for additional sites. And here we have a chart displaying our target versus actual recruitment. Unfortunately, we are under target, but we do hope that with the addition of the new sites that we're able to make up the difference. If you are interested in participating in the study as a recruiting site, please do contact us at petstrial@imperial.ac.uk. Our email address is displayed here. In terms of what sites will receive, you will receive a payment of £28.20 per eligible patient that you consent. So these are patients that you consent who are then eligible to be contacted for follow-up. And the study is also registered for the NIHR Associate PI scheme as well. Thank you very much, and I welcome any questions.
Thank you so much. Thank you for sharing your email address. And if you can keep it there for a while, so if anybody is interested, I know they can email you directly to find out more details or to liaise about hopefully joining in. Looking at the map, it showed obviously all your sites. They looked as if they were all potentially within England. Are you able to accept sites across the UK?
Yes, absolutely. Absolutely. So we do have a couple of sites set up in Wales. We are exploring possible support from Scotland and Northern Ireland as well. If we do have any representatives from anyone in those regions, we'd be more than happy. But yeah, absolutely, anywhere across the UK.
Brilliant. And I guess the key criteria first is that they have eligible patients, but then otherwise to get in contact, see if they can be involved, if it suits both sides, to progressive, because from a NHS resources perspective, prescriber and carer perspective, and definitely from a patient perspective, this is a really important trial. The stockings can potentially be beneficial, but they can also cause harm when not fitted and not used appropriately, and to know when they're good and when it's not worth using them will improve care and improve patient outcome as well. So it's really, really important. Thank you very much. I would urge anybody, I'm going to be advertising this on our e-shots over the next week. Please do get in contact to find out more, or if you'd like to, thinking of becoming an involved site, it will be of huge help. And we'll be looking forward then to seeing what the results are in a few years' time.
Thank you.
Thank you very much, Sarah.